we are well into the home stretch for day one. And I think everybody, from the feedback that I have constantly gotten and staff too, we are learning so much. There's a lot yet to be done, but we are absolutely learning a lot. This third panel is going to deal with the workforce, and the individual who's going to moderate it, Dr. Thomas Ricketts, I'm having the pleasure of introducing, and he will then introduce the panelists. Dr. Ricketts, we're very happy, joined us as a professor of health policy and administration at the School of Global Public Health, and professor of social medicine in the School of Medicine, and deputy director of the Cecil G. Shep Center for Health Research at the University of North Carolina. Dr. Ricketts.
Thank you, Maxine. We've talked a little bit about what is going on in birth settings. We talked really about where the birth is supposed to occur, a lot about how well it's done, how it's done, when it's done. Now we're going to confront some of the questions about the who does it. Because this is, when we're talking about workforce, we're talking about the people who do things. And it's not just who does what, but who is allowed to do what. And who gets to do what with whom, who gets to be on the team. Also, who takes the responsibility for something when something goes bad, or gets the responsibility shoved on them. We're going to talk about professions and professionals, but these are people, really. And people who are given special responsibilities as well as obligations, as well as the opportunity to get paid and recognized by state governments. So we're going to start our discussion with a leading health workforce researcher and policy leader from the University of California in San Francisco, Catherine Dower. She's the Associate Director of the UCSF Center for Health Professions. And that group is one of the national leaders in development of workforce policy, doing research, but also connected research. And Ms. Dower's work, she's an attorney. I guess you can say Juris Doctor, but she is an attorney, which is a good thing because my wife is also an attorney, and I know they do great work. And but she's studied midwifery in the United States, but their work has been really led the nation in terms of understanding how groups and teams can work together. So without further ado, Catherine Dower.